I'm Kimberly Davidow, contributor to the Huffington Post, and joining me is New York Times bestselling author and nationally recognized geriatric psychiatrist, Dr. Gary Small. Dr. Small, thank you so much for taking the time to speak with me.
Thank you, Kimberly, for speaking with me.
What is your backstory?
So I've been a doctor for a number of years, and it all started when my father, who was a doctor, said to me, Gary, you can do whatever you want in life. Just make sure you go to medical school first. So I decided to follow his advice, even though part of me wanted to do something more creative. I played piano when I was young. I liked writing, but I was always drawn to medicine because I liked the idea of trying to help people. And it turned out that I was able to pursue creative things in my career through my research and writing. So it was good that I followed my father's advice.
Dr. Small, can you just share with me one of the most interesting stories that happened to you in the course of your professional career?
Many different stories come to mind. And I even recall a few years ago, I wrote a book with my wife. We called it The Other Side of the Couch, where we describe some of the most unusual clinical cases throughout my career. And so some of those always come to mind. One that really struck me was I was starting out, I was at Mass General Hospital in Boston, and I was learning to do psychotherapy. And so I had a case where it was a woman, I think she was from Haiti, and she came in and she had some hand pain or arm pain. And I was trying to formulate a psychodynamic, psychological explanation for this. And I was, going through these explanations. And I said, well, this is what's happening. And, I think that your pain is due to psychosomatic disorder. And she said, fine. I said, well, I'd like you to start coming in for therapy. She said, fine. So she came in the next week and we started talking. And I started asking about her week and what's going on. And she said, well, when does the therapy start? And I said, well, the therapy is really starting just by having this conversation. Then she raised her arm and said, no, when does the therapy start? So I think that was an example of sort of a neophyte psychiatrist trying to figure things out. But, in the course of a career trying to help people, there's just so many unusual things that happen, and some of them are humorous. And in fact, humor can really be very helpful in healing people, and especially these days when I see more families and patients with Alzheimer's disease, people are really suffering. And if they can sometimes see the humor of the situation, it can give them perspective and really be therapeutic.
How have you used your success to bring goodness to the world?
So, I think that I'm fortunate that, we started this conversation, I talked about my father, and both my parents were altruistic people. They liked helping others. They derived joy from that. And I think that to me, it's been great to be able to do that. It always makes me feel good to help others. So it helps me to help you in a way. And so I think that it's great that if I can discover something in science and then somehow figure out a way to bring that to patients and to the general population, it's tremendously gratifying. So, I see that in many different ways. For example, one of my jobs is directing the UCLA Longevity Center. And, I always say we're sort of bench to bedside to curbside. So bench to bedside means that we make discoveries in the laboratory and then bring that to the patient, but then we take it a step further where we take it to the public. So we've created memory training and healthy lifestyle programs that we license all over the country and different parts of the world. We're in China and Canada and South America right now. And so it's really great to see that that's helping people. Or or just with the books. I mean, sometimes people will tell me, my God, I read that book and it really helped me. And I'm just amazed. It makes me feel that that's quite remarkable that you can write something on a page, connect with someone somewhere in the world, and they give you feedback and they thank you.
Do you think there's not a lot of awareness surrounding Alzheimer's disease? And if so, tell me why.
There is not a lot of awareness. If you look at some of the recent data that's been collected, about half of patients with Alzheimer's disease are walking around, they don't know they have it. And they don't have it because the health system pushes back on it. Doctors are very busy. They don't have time to look into it. They know that if they make a diagnosis, it's going to take more time. It's going to cost more money. Patients are afraid of the diagnosis, so they don't come in to get help. So there's a lot of education we have to do to teach people that, yes, we have no cure, but we can do a lot. For example, in my career, we've come to find medicines that actually help with the symptoms. They don't cure it, but they stabilize the symptoms. And I've been working on a lot of different campaigns to educate family members, to educate patients, to educate physicians about how much we can do. Actually, I'm in Houston right now. I'm going to give a talk to some doctors about a medication, Namzaric, which is the first combination pill of the two medicines that are available. And it's always remarkable to me that these very bright physicians are not doing as much as they can do to help these patients and really make a difference in their lives.
Given recent clinical study outcomes, many Alzheimer's disease patients and their caregivers may feel there is no hope or no treatments that can help. What would you say to those individuals?
If you have a concern about your memory, go see the doctor and find out about it. I mean, the good news could be that there's nothing to worry about. But if the doctor detects a problem, the sooner they get on medication, the better off they're going to be. There's been many studies showing that. And in fact, when you have greater cognitive ability, that's when you can benefit from the treatment the most. And it's not just medication treatments. There are the symptomatic treatments that are available, like Namzaric, but there are also lifestyle choices people can make that can help stabilize the symptoms. And if you're at risk and you don't have dementia as yet, you can actually lower your risk and stave off the onset of symptoms. So physical exercise, stress management, treating medical conditions like hypertension and high cholesterol, dealing with diabetes, proper diet, all these simple strategies have a huge impact on a person's brain health.
November is National Alzheimer's Disease Awareness Month. Why do you believe it's so important to get that awareness and that message out there to either caregivers, patients with Alzheimer's, and maybe for those that aren't necessarily directly affected in one way or another with Alzheimer's?
The greatest fear most people have is losing their minds. And when patients do develop Alzheimer's disease, what is behind that fear is losing their independence and their autonomy. So how do people deal with it? They deal with it by denial. They don't want to find out about it. And it's easy to do that because Alzheimer's disease is a very subtle, insidious problem. It comes on quite gradually. It looks very much like normal aging. You forget your keys, you can't remember someone's name, and you just slough that off. All my friends have that problem. But those early symptoms could be a signal that something worse is going on, and the doctor can help to find out what is going on.
What are your 5 things you wish someone told you when you first started working with Alzheimer's disease patients and their caregivers, and why?
So I think one thing would be slow down. I joke with people, I like to practice what I preach and I exercise regularly. But I have a type A brain with a type B body. So I tend to do too much and push myself too much, and I injure myself. And I think, with that kind of type A personality, I tend to be impatient and want things to go quickly. But I find if I can slow myself down and take my time, the answers come. And I'm less likely to make mistakes. I mean, it goes along with multitasking, doing too much at one time. But slowing down, it would be a great lesson I wish I had embraced at a younger age. I wish somebody had told me after, I think this is kind of a corollary of the first one. I love this. After 20 years in the business, you'll become an overnight success. So, what that's about is to take baby steps and to just be methodical and do the systematic studies that need to be done or help patients in that way very slowly. And you can see there's a building over time. There's a building of trust. You find that the little pieces of the jigsaw puzzle start fitting together. So I think taking those baby steps is an important lesson. But this is something that, I actually don't wish for this, but this is something that happened to me later in life. And that is that Alzheimer's struck people close to me personally. And I think that has given me much more empathy for what people go through. And I studied it in books and with patients, and I understood it intellectually. But I think until it struck you personally, you really don't completely understand what it's like for patients and families and what they're going through. A fourth one, I think in terms of, I would think of this broadly, not just in terms of working with the families, but in terms of the research. And that would be connect with people outside of your field. Because when I look back at the most impactful discoveries of our team, it really had to do with working with people at other areas of expertise who brought other ideas, fresh ways of looking at the problems to the table. So for example, a number of years ago, we discovered the first brain PET scan technology to be able to visualize Alzheimer's disease in living people, amyloid plaques and tau tangles. And that resulted from conversations between me, a clinical investigator, a chemist, and a neuroscientist who worked with animal models. And so each of us were coming at the problem from a different point of view, and together we were able to move forward in a way that changed our method of looking at the problem. And I think the final lesson I would have liked to have learned earlier, but fortunately I learned it kind of mid-career, and that is that it's easier to protect a healthy brain than try to repair damage once it's extensive. And that's really driven a big part of our clinical program, our research program, in trying to detect people early and trying to help them prevent problems rather than try to treat the problem later on. And I see this very much in the way the field has gone. For example, there have been studies showing associations between taking anti-inflammatory drugs and a lower risk for Alzheimer's disease. And what happened as a result of that is doctors tested anti-inflammatory drugs in patients who already had dementia, so patients who were further along. It didn't work. But when they started using the medicines or other anti-inflammatory treatments as prevention approaches, it looks like it may have more of a benefit. So it's really, in real estate, the three most important things are location, location, location. But I think in Alzheimer's disease, it may be timing, timing, timing that makes a difference.
My last question for you is, if you were to have dinner with anyone, who would it be and why?
So I would say Albert Einstein. I mean, I've always been fascinated by Albert Einstein and what he contributed and how he thought. And I know as a kid, I read a book, I think it was called Dr. Einstein and the Universe. And I learned that I think he failed arithmetic or mathematics in school. He didn't seem all that bright early on, but he was he was a thinker who thought outside the box and really made a difference. And the other thing I liked about him is he had a spiritual side. He was a theist. He believed in God, even though he was a really an adamant scientist. So I just marvel how some people can think so differently and make fundamental changes that impact the world.
Dr. Gary Small, thank you so much for your time.
Thank you. It's been a fun conversation.